Hello, my name is Nof. Now we will talk about sleep and rest. الأوتلاين age-related change in sleep, circadian sleep week circles and the sleep stages. A learning object after reading this presentation, if you should be about to explain difference between younger and old adult in sleep stages and circles. Terms to noun الأيزونيميا inability to fall asleep, difficult sitting asleep or prematurity waking. Necrotial myclonius condition characteristic by at least a few leg jiggers or movement per hour during sleep. Sleep adivinus, feeling asleep earlier in the evening and awakening earlier in the morning. Restenius leg syndrome, a neurological disorder characteristic by an uncontrollable ergot to movement legs when on lays down. Sleep apnea disorder in which at least a few episodes cessation of breathing lasting at least 10 seconds according per hour of sleep accompanied by daytime sleepiness. Sleep latency daily in the honesty of sleep. Age related change in sleep, all human beginning most returned from activity and stimulate to renew their reserves. Several periods of relaxation throughout the day and a block of sleep help promoting a healthy pattern of rest. The fact the person spends nearly one third of his or her life time sleeping and rest and under sequenders the significant of this activity. Sleep is often mirrored into the outer status of health and well-being and that may be restraints and inability optimal sufficient sleep in the present of pain, stress or impaired body function. It also is the factor that affective health well beginning as an inadequate quality or quantity of sleep is associated with the risk to physical and mental health. أن عدد فترات الاسترخاء تعزز النمط الصحي من الراحة وغالبا يكون النوم يكون مرآة لحال صحتنا ورفاهيتنا بحيث لما الشخص يكون عنده ألم أو إجهاد أو ضعف في الوظائف الجسم يكون غير قادر على النوم. عدم كفاية النوم أو كميته أنه مرتبط بمخاطر الصحة البدنية والعقلية. Thank you for listening. Continue with ضيف.
Hi, my name is Taif and I will talk about nursing diagnosis and circadian sleep-wake cycles. Nursing diagnosis, aging and risk to the ability to achieve rest. Causes are contributing factors, increased awaking during sleep, sleep stage 3 and for less prominence. Nursing diagnosis, description in sleep pattern related to less prominent sleep stages and increased incidence of nocturia. Nursing diagnosis is disruption in sleep pattern related to nocturia. And altered perception of night environment resulting from visual and hearing deficit. Nursing diagnosis, anxiety and fears related to difficulty in falling asleep, and increased incidence of muscles cramps during resting state. Nursing diagnosis is acute pain related to muscles cramps. Change that occurs with aging and condition experienced in later years can interfere with the ability to achieve adequate sleep and rest. Astute assessment is necessary to ensure that older adults fulfill sleep and rest requirements and to identify obstacles for which intervention is warranted. Age-related change in sleep, which is insomnia, daytime sleepiness, and napping, are all highly prevalent among the older adults. In most cases, these experiences result from age-related changes in circadian sleep-wake cycles, sleep stage, sleep efficiency, and sleep quality. Okay, then circadian sleep-wake cycles. Older adults are more likely to fall asleep earlier in the evening and awaken earlier in the morning, a behavior referred to as phase advance. The quantity of sleep doesn't change, but the hour in which it occurs may. This change can provide frustrating for older adults who find themselves nodding off during evening activities and wide awake in the early morning hours when everyone else is asleep. In addition, daytime naps may be needed to compensate for reduction in nighttime sleep. Adjusting schedules to accommodate the altered biorhythms could provide useful. Increasing natural light is also useful in pushing the circadian rhythm toward a later hour of sleep. Just that, and we complete with that.
Hello, my name is Ahad Suleiman, and I will start to complete the last things in our presentation, which is sleep states. For sleep to be most restful, the person experiences a series of sleep states. Changes in the amount of time spent in each state occur with aging. Reductions in non-rapid eye movement stage sleep and rapid eye movement stage sleep begins to occur after midlife. Older people sleep less soundly, shift in and out of stage 1 sleep to a greater degree than do younger adults, and spend time in stage 1 and stage 2 of sleep. They have a decline in the proportion of time spent in the deeper stage 3 and stage 4 sleep. We have here table of about stage of sleep and difference in order. We have 5 stage. The first stage is one stage with characteristic with begins nodding off, can be easily awakened if undisrupted, will reach next stage in few minutes. The difference in order, which is more time spent in this stage, must likely die too. Frequent awakening and increased number of areolas and shifts into non-rapid eye movement sleep. The second stage, which is two stage, characteristic of a deeper state of relaxation rest. Some eye movement noted through closed lids. The difference of stage 2 is no significant change, although older adults may spend more time in this stage. Stage 3, which is early phase of deep sleep, reduced temperature and heart rate, muscles relaxed, more difficult to be awakened. The difference is decreased. IV stage, which is fourth stage, characteristic of deep sleep and relaxation, all body function reduce, considerable stimulation needed to be awakened. Insufficient stage IV sleep can cause emotional dysfunction, and the difference is decreased in older. The last stage is REM, which is rapid eye movement occurs, increased vital signs, sometimes irregulars, will enter REM sleep approximately once every 90 minutes of stage IV sleep. Insufficient rapid eye movement sleep can cause emotional dysfunction, including psychosis. The difference in adult will decrease diet to reduce amount of sleep time in general. The last things we have is summary of the presentation. The aging process affects sleep in many ways. Older adults tend to fall asleep and wake up earlier than in younger years, sleep less soundly, and experience a reduction in stage for sleep. Insomnia, nocturnal myoclonus, restless leg syndrome, and sleep apnea are among the most common disturbances to the sleep of older adults. A variety of factors that can affect sleep requires that a thorough sleep history be done as a part of comprehensive assessment. And thank you for your attention. That was our presentation.